Hi, I'm Isabella Brown, and today we'll be talking about nutrition therapy for hepatic encephalopathy. This video is meant to educate nutrition students, not to treat or diagnose. We won't be talking about every aspect of hepatic encephalopathy, but we will mostly focus on what a dietitian would need to know to treat this patient. Hepatic encephalopathy is when someone shows symptoms of brain dysfunction, usually marked by elevated ammonia levels. It's often caused by cirrhosis, abnormal blood vessels due to portal hypertension, but the number one reason is the TIP surgery. In hepatic encephalopathy, or HE as I'll call it from here on out, the buildup of ammonia leads to confusion and eventually a coma, so it's important we treat it as soon as possible. Lactulose is the most common treatment of HE. It's a prescribed laxative. It's very sweet, so patient compliance is an issue. To increase patient compliance, you can recommend the patient combines their dose of lactulose with half a cup of juice, water, milk, or a soft dessert like pudding or ice cream. But if the patient has poor blood sugar management, avoid recommending fruit juice or the dessert because the lactulose is probably already raising their blood sugar levels. But at the end of the day, you need to find the balance between managing blood sugar and compliance. It's probably better that a diabetic patient drinks the lactulose with the fruit juice than not at all. If your patient is insistent on drinking the lactulose with juice, help them find other strategies to lower their blood sugar, like weight loss, exercise, or drinking the solution with a high-protein snack. Rifaximin is an antibiotic that can be taken with lactulose. The two medications together are very effective, but rifaximin is usually a secondary treatment to lactulose. Now we'll dive more into the nutrition therapy of HE. Muscle breakdown increases ammonia levels and makes HE worse, so we want to focus on building or maintaining our patient's muscles. Often, patients will need 35 to 45 calories per kilogram of body weight and 1.2 to 1.5 grams per kilogram of body weight of protein. This can be adjusted for obesity or increased muscle loss, which is usually signified by albumin levels of less than 3.5. Branched-chain amino acid supplementation may also help with maintaining muscle strength. Previously, the recommendation was to reduce protein intake because protein digestion increases ammonia. While protein digestion does increase ammonia levels, we still want our patients eating protein because muscle breakdown and not eating enough protein has a worse effect on HE than protein digestion. However, digestion of plant-based proteins produce less ammonia when digested and can help build muscle. Really the best of both worlds. So you might want to recommend plant-based proteins such as tofu, nuts, seeds, and beans. Supplements that can help improve HE are branched-chain amino acids, carnitine, and zinc. Liver patients are likely deficient in these supplements. Studies show mixed results, but as long as the individual is not consuming more than the upper limit and they are choosing USP certified supplements, they are likely not going to have any negative side effects. Recommended doses of branched-chain amino acids are about 20 grams per day, and 1.3 grams of L-carnitine may be beneficial. The upper limit for zinc is 40 milligrams per day, but most of the studies supplemented with much higher doses of zinc. Until more studies are done on zinc supplementation and liver disease, patients should avoid taking more than 40 milligrams of zinc per day. Poor gut health may lead to the production of neurotoxins, so it's thought probiotics may improve gut health and reduce neurotoxins in the body. Studies show mixed results on probiotic supplementation in HE, but it probably would not hurt to recommend yogurt to your patient because it contains both probiotics and protein. You can also support gut health by consuming adequate fiber throughout the day. This will also help with blood sugar management. Patients may lose a lot of fluid while taking lactulose, so make sure they are drinking enough water, which is about 2 to 4 liters per day. However, if the patient shows signs of hyponatremia or ascites, fluid intake may need to be reduced. Thank you for watching. Make sure to like and subscribe before you go, and comment below with any videos you'd like to see. Thank you.